All right, so let's go through this question, right, and identify what the three parts, which are what the body, the stem, and what your answer is. This is your standalone question, right? Now you can see we have the first top part, we have the second part, right? On the NCLEX exam, you're going to see something like this. That's your stem. That's what the NCLEX used to make you identify the real question, because this part is not your question. This is just trying to just let you know the content, right? Or the scenario which you can be able to like pick out the content NCLEX is testing. Right. Sometimes your content will not be written straightforward, right? It will not be written straightforward. Right. So what you just need to do is to understand what is going on here so that you can easily um guess or know the content. You should not be guessing, because you should know, right? Because if you have gone through the audio content, you should know. Like now, when the NCLEX is saying the nurse and UAP are caring for assigned client, right? So the nurse, right, and then the UAP are caring for what assigned client. Now they are not telling us the particular kind of care, right, that they are what giving. They only just said they are caring for assigned clients. Now this is a way NCLEX write what delegation question, right? If the NCLEX is saying the nurse is caring for assigned client, right? The nurse and UAP are caring for assigned client, right? That's a way NCLEX write delegation question, right? So because normally if the nurse is caring or the UAP is caring, there's a specific care that the NCLEX will give you right on the body of the question. But right here, we are not seeing any specific care, right? Whether they are caring for a client who have hypertension, or a client who have diabetes, or a client who have anything, or any specific need, right? We are not seeing it. They are only just talking about the nurse, UAP, caring for assigned client. So this is a way NCLEX test what delegation, right? So now when NCLEX is testing your delegation, there are two ways NCLEX test delegation. We have what assign, right, and we have best direction. Now I knew this because I did my analysis on what 1,940 questions. Initially, I was just thinking, oh, the NCLEX will focus on assign, whereby all you just need to do is to decide the right tax, and then patient should be what stable. So that was what I was thinking initially. So I know best direction is there because we have the 5 right principle of delegation, right? Now, well, know we have best communication. Is it best or yeah. Okay, right. It's not best. It is right communication, right document. Right communication, right direction. I mean, right communication, right direction. So I was not even thinking what NCLEX will test something like that, because I was like, okay, is either the NCLEX will test you on who are you going to assign to what, an RN, LPN, UAP, right? Or they are going to give you various what are they calling it, assignment, and then they will tell you RN is working, LPN is working, UAP is working, and then look for the particular tags that you're going to assign to the LPN. So this was all my thinking. Not until I what did my analysis on this, and then I noticed that from seeing more than 20 to 30 what are they calling it? A delegation question, right? This is what the NCLEX test. And I can guarantee you, because for the past 2 years, my students will either see this or this, right? Right. They will either see this or this. Most especially LPN will see this the most. No, let me not say this. This is what you are going to see the most, right? But sometimes RN don't see this, LPN see this. Sometimes RN see it, right? Because most students will say, "Oh, I got assignment question. I did not see any best direction." Right? Some LPN will say they see this, right? So common on the LPN exam, but the both are you are definitely going to see it. If you see maybe 5 of these, you might see 1 of this, right? You might see 1 of this and then 5 of this, right? So pay attention. So that's the main reason why you want to know how the NCLEX write the question. Because if I did not know how the NCLEX write the question, when I see best direction question on the exam, I would have been like, how do they want me to answer this question or something like that? Even if I will get the answer, I'm going to like overthink it, right? But guess what? Since I already know how the NCLEX write the question, I don't need to what? Overthink it. So now all I just need to do is, because I know this is a delegation question, I have an idea how the NCLEX write the question. So I'm just going to go read the answer key to make sure um we are in line. So now, which of the following activity would be appropriate for the nurse to assign to what? The UAP. You can see assign. If it is best direction, assign will not be there. NCLEX will replace it with what? With what? Best direction. You understand? So pay attention to the examiner. So now this is your body, and this is the examiner question, which is the stem. So now I now understand that, oh, the NCLEX is testing me about assignment, which is delegation. Now, just in case maybe you uh you read the body. Now, the nurse and UAP are caring for assigned client. If you don't really understand what the NCLEX is testing, if at that point you don't still understand what the NCLEX is testing, now read the stem. Which of the following activity would be appropriate for the nurse to assign? Let me erase this. Assign to UAP. So now activity to be assigned. Now it makes sense, right? Now you can easily now tell that, oh, this is what? A delegation question. If from the stem, you are not able to still identify that it's a delegation question, read the answer keys. Briefly scan through the answer key. Apply condom catheter, apply pressure dressing, obtain vital sign. This look like we are trying to what? Delegate tasks. So obviously, it's all screaming delegation, 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 delegation. Like I said, if you don't understand how NCLEX write the question, you might be focusing on only what? Assignment. But guess what? NCLEX write the question in a different way. Right. If you see assignment question on the exam, obviously I expect a lot of students to answer it correctly. Right. But most students don't know NCLEX test best direction. Right. I discovered that afterward, breaking down 1,000 NCLEX pass question. That's why I can easily tell you, pay attention, because a lot of students will be so excited and they'll be like, oh, thank God I know this is a delegation question, and they will not pay attention to the fact that NCLEX can test you on a sign or best direction. Because the way you answer a sign is different from the way you answer best direction question on the NCLEX exam. Right. So yeah, but I'm not here to talk about how you answer assign best direction. I'm only just here to break down live example from the NCLEX past question, so that you can be able to identify with me the body of your question, the stem, and then what? The answer keys. So this way you already know it's a delegation, and NCLEX is testing on assign. So you just need to apply the principle of assign. The principle of assign is that you need to know the who, you need to know the tax, and you need to know the condition. So the who is what? UAP. Now, there's one thing you need to know. RN stable. You need to know this table, right? Let me say LPN. Oh my God, what am I writing? You need to know this table. RN unstable, I mean LPN stable, and then UAP stable, right? So this is the table you need to follow, right? So now, since I know the who right here, which is UAP, then I expect the tax to be what? Stable. The tax. Oh my God, why am I making this mistake? Right. I expect the tax to be what? Within the scope of practice. But when we are thinking about the tax, The task should be within the scope of practice of the UAP. So the condition should be what? Stable. This is where I think about the condition. The condition should be what? Stable. Right. Don't mind me. Now, so this is your thinking process. So now, the first thing is to focus on what? The task. Then I'm going to look for the task. Applying condom catheter, applying pressure dressing, obtaining vital sign, inserting NG tube. Right. So I'm going to ask myself if the task is within what? The scope of practice of who? The UAP. So applying condom catheter, yes. Applying pressure dressing, no. Obtaining vital sign, yes. Inserting NG tube, no. They cannot do invasive procedure. They cannot do anything dressing. Right. They can do ADL dressing, but this particular dressing, pressure dressing, is not the ADL dressing. This dressing is like a wound dressing, and you can obviously see a stab wound. But guess what? Don't focus on the condition yet. What we are doing right now is the tax, right? Because if you focus on the condition, you might not really know what to eliminate, right? But guess what? Because we only focus on the tax, you can see we have eliminated option 2 and what? Option 4. We are left with what? 1 and 3. That is smart, right? That's smart. This is what I teach students in my course program, right? Smart way to answer question. We are not about to be overthinking on the NCLEX exam. So now we know our O, UAP, we know the tax. Within the scope of practice, we'll be able to identify that. So that is clear. Now the last part is the condition. Now let me tell you something. If you utilize this method, sometimes you will only just stop right at the tax. You already know your answer. But because obviously you would have been able to X out 3 option. But in this case, we X out just 2, and then we are left with 2, which is 1 and 3. So now, in order to decide our condition, remember, according to the table, UAP receive what? A stable patient. So now we just need to look at what they are experiencing, their condition. So this is delirium tremor incontinence. So delirium tremor incontinence, who is stable? Obviously, number 1 is stable, and number 3 is not stable. So that way, number 3 we exit out, and we are left with number 1, which become what? Our answer. Right. So that is smart. So to recap, we try to identify what the NCLEX is testing from the body. We knew exactly what the NCLEX want us to answer, and then we broke our answer in line with that in order to what? Answer the question. Right. So if it is best direction, trust me, you cannot use this approach to answer best direction, because best direction is not testing on the specific task to assign. Instead, best direction is trying to test if the statement have everything necessary to assign that task to the UAP. Right. Is the statement clear, not vague? Is it specific? Right. Is it within the scope of practice? Is the condition stable? Right. For UAP, right, or the LPN, right. So the who is the who as well to specific, because now if you see if you see a particular statement that is saying we should document, we is not specific, because who is doing the tax? We NCLEX don't know what is we, right? It is you. This is specific, but we is not specific, right? So now you also want to know, is the tax for because there are some certain tasks that only give instruction to the UAP. We don't do tasks that give instruction to the UAP. We do tasks that the UAP can carry on what? The client. Like telling the UAP to what? Perform hand hygiene. That is a specific task for the UAP and not for the client. Right. What are you doing for the client? Because okay, after you perform your hand hygiene, what are you doing for the client? We want to see that. When NCLEX is just saying perform hand hygiene, that is just for the UAP. Has nothing. You are not yet doing anything for the client, right? So I'm just giving you hints, right? It should be clear, not vague. Vague like saying perform ADL. What is ADL? Are we bathing the patient? Are we dressing the patient? Are we feeding the patient? NCLEX wants you to be specific, not ADL. ADL is vague. So if you see ADL on the NCLEX exam, it's wrong. But bathing, dressing, that is what NCLEX wants you to think about. You can see we are not trying to delegate that. We are only just trying to go through the statement to be sure that it's accurate for what it's an accurate statement that gives clear direction, right? Is specific, not vague, right? So And we try to see that through the what? The who, the task, the condition. So we look at the who. Is the who specific and clear? Is the task within the scope of practice specific and clear? Right. Is the condition stable? Sometimes NCLEX will not include condition. It might be just routine task, right? But if there's condition, you need to ask yourself, is it stable? Right. So yeah, that is how you answer best direction question. So I'm going to see you in my next video.